Civil society organizations have voiced serious concern following the United States government's decision to withdraw $50 million in annual health funding, citing the persistent theft of donated medicine within Zambia's public health system. Leading the response is Fred Chungu, Executive Director of the Network of Zambian People Living with HIV and AIDS, who describes the announcement as a deeply saddening development with the potential to reverse years of progress in the fight against HIV.
From this support, we have seen so many achievements, so many milestones have been tackled. And again, when you look at 95, it is through their support that we have achieved all these 95, UNH 95. Otherwise, concerning this issue that we had yesterday from the US ambassador, it's quite very saddening for people living with HIV and just for Zambians in general. You know, as a network of Zambian people living with HIV, we've got members that are on life-saving drugs. It's our life on treatment. And looking at the population of the people living with HIV in Zambia, about 1.3. So it's quite, it might be quite risky.
Mr. Chungu has further urged the government to expedite trials on the Sondashi formula, a locally developed alternative treatment for HIV which he says could play a more prominent role in the country's health response if validated.
So this time I would urge the government to look into the Sondashi formula and complete all the trials that are involved in the manufacturing of these drugs, so that we can have our own drugs and start manufacturing the drugs within Zambia. I think that can be, a relief to what we are getting from other countries as donors, as well as our data government, as well as to invest a lot in research and development.
Meanwhile, Flora Msiska, Senior Programs Officer at the Alliance for Community Action, has expressed deep concern over the U.S. funding cut, stating that it underscores the urgent need for stronger accountability systems within Zambia's health sector.
It is troubling to know that these are medicines that citizens could and should have had if only government had carried out its critical duty to protect, prevent, address and punish the brazen theft of public resources that is the characteristic of service delivery in Zambia. Following the U.S. withdrawal in health funding, the SCA calls on the government to institute an urgent and transparent investigation into the health sector in Zambia with emphasis on delivery of drugs. Take decisive action against all actors involved in the illegal diversion of medicines. Expose and fix all vulnerabilities found and implement lasting reforms to bring sanity to our medical supply chain.
The civil society self-coordinating mechanism also weighed in, warning that the situation demands immediate coordinated action. As calls grow louder for accountability and reform, pressure is mounting on the Zambian government to act decisively and restore confidence in the management of donor-funded health programs. Ray Chomumba for Diamond News.